We are all here. So again, thank you, Melanie and Tequila and Nancy and Shelly for joining us today. As I said, we really can't achieve food equity without work with all of our partners. But before we jump into some questions for our esteemed panelists here, I wanted Nancy to give you just a few minutes to kind of give an overview and welcome our listeners and panelists, just to talk a little bit about PHA's work and why food equity is so important while we're here.
Yeah, well, thank you so much, Jason. It's terrific to be here with all of you and our great panelists. So, listen, food equity is the idea that every single person in every zip code deserves access to good food that they can afford and that will build their health and help them live well. And despite the very strong connection between healthy eating and health, millions of Americans, as we know, lack access to healthy food. So this is serious because 1 in 2 Americans suffers from chronic illness linked to their poor diets. So what we eat really matters, and our food system should be helping us make good choices and build our own health and that of the overall public. Our overarching goal at PHA is to fix the broken food system so we all have a chance to live healthy and well. That's food equity. So to shift the entire system, every single sector has to play a role. We need the government to provide R&D and to educate children pre-K through college about the importance of food, to offer tax incentives for better food sourcing and models. We need the private sector big time. Big manufacturers like Nestle, Unilever, Kraft must develop and market better, healthier foods. And we need new players to get in the game and innovate with delivery and technology to reach underserved communities. So PHA's job is to catalyze change and to elevate and amplify the work of others who are making a difference. Couple of quick examples. During COVID, we established a new program that distributed more than 20 million servings of fresh produce to families in 29 cities. And we did it with an eye to the future. We designed the program to really expose people to produce, 2 servings a day, 7 days a week for 12 successive weeks. Why so much for so long? Because the model leaves a lasting habit of produce for these families. And that matters not just for those families, but for demand creation. Then step 2, we're working with the private sector, and in particular, working with startups and new growing companies like Instacart who are innovating to fill that newly identified demand. We've also partnered with Nihilus, an Argentine-based company that's selling produce direct to low-income consumers. We're piloting their arrival here in the United States in Hialeah, Florida next year. And then in the charitable sector, 60 food bank partners have removed 19 million pounds of junk food from their inventories and added 122 million pounds of healthy food. Last point. One of the few non-controversial areas in this whole space are fruits and vegetables. People of every race, religion, and geography eat too few. In fact, only 10% of us eat what we should for our health. So alongside the White House Conference on Hunger and Health, we have committed to adding 100 million additional servings of vegetables and fruits to the marketplace in disadvantaged communities by 2025. It's an ambitious goal, but important if we're serious about public health. So over to you, Jason.
Great. Thank you, Nancy, for that. I feel like that's a good a good overview, but really what I'd love to do is talk to our speakers on the panel too here. Our panel today is made up of an incredible group of food equity leaders and champions. I'd like to take just a couple minutes to let our panelists introduce themselves. And I'd like to start with Shelly Parks from the Jacobs and Cushman San Diego Food Bank. Shelly, if you don't mind introducing yourself.
Thanks for having me, Jason. My name's Shelley Parks, and I'm the Senior Director of Programs at the Jacobs and Cushman San Diego Food Bank. And I really got started in food security back in 2007 when I was getting my master's in social work. I was placed at an internship at Jewish Family Service, and I was case managing alongside the food pantry, all the clients who were coming to the food pantry. As I graduated in 2008 and we were upon a recession, my supervisor at the time said, "Do you want a job right out of college with your master's degree?" And food pantries was not kind of what I was geared to do, but the job was there; it was available, and I was aiming to work in the school setting, and all the school social workers were being cut at that time. So that was back in 2008. I'm here 15 years later, having worked at a food pantry for 7 years and then moving to the food bank, and I've been here for 8.5 years. So I really kind of fell into this by happenstance, but I absolutely love food security, and it is my passion.
Wow, thank you, Shelley. It's really interesting to hear some of the backstory about how you got into this space. So we're really grateful also that you're one of our 60 Healthy Hunger Relief Food Bank partners that are really focusing on the charitable food system and nutrition within the system. So I'd like to turn it over to Melanie Potok, a pediatric feeding expert and author. Melanie, would you introduce yourself next?
Sure, I'd be happy to. Hello to everyone who's listening. My name's Melanie Potok, and I have a little bit of a unique career. I'm a speech language pathologist who specializes in what we call feeding. So basically, I love kids and food. If I'm working with a child 6 months old learning to start solids, or whether I'm working with an older child with special needs who needs specific techniques to learn to chew and swallow, my ultimate goal is to help those kids find the joy in food. And it's all about consistency and exposure. And as Nancy so beautifully said, so many of the kids in our communities don't have access to the foods that I need to help them learn to find the joy in food. If I don't have access, how am I going to help them? So that's why I'm an active volunteer with PHA and have written books on the topic. And I'm just so pleased to be here to listen to all the other speakers as well. So thank you, Jason.
Yeah, thank you, Melanie. And someone who has spent their entire career helping families and communities raise healthy, adventurous eaters. We're really honored that you could join us today. Finally, I'd like to hand it over to Tequila Tinker Martin to introduce herself. Tequila?
Good afternoon. I am Tequila Tinker Martin. I am the Food Equity and Community Engagement Coordinator for the Division of Community Nutrition and Food Policy. We work out of the Office of Public Health and Safety for the City of Indianapolis. And I tell people I am so fortunate that I get to get paid, right, to do what I am passionate about. So I have been in this sector of volunteering and serving my community for almost 30 years. And now I have the ability to work and do the same things that I have been volunteering and doing from my passion over the last 29 years. I am new to this position as this division within our Office of Public Health and Safety is fairly new as well. And so I'm the first person to have the position as the Food Equity and Community Engagement Coordinator. And what I typically do, I do outreach. So I go around to communities and agencies, and we see how we can bring in quality food to our communities, to our neighbors, at no cost to them. So we're establishing relationships in our communities. We're creating spaces where our community members can have a voice, and we see what the need is and how can we, as a partner with our neighbors, address these needs.
That's great. Yeah, thank you so much, Tequila. We're glad you're here. And really, the work that's happening in Indianapolis, even outside of how you're partnering with PHA, it's amazing. But through some of the work that we've done together, we were able to reach 1,000 families in Indianapolis with about 800,000 servings of fresh produce last year. And then this year, we're building on that work again with more fresh produce free to families, but then also coupled with a program that will help families purchase produce of their choosing, either through grocery delivery online or also in local community grocery stores. So a big thank you to all of our panelists for being here. But now let's get into it. So This question is really for all the panelists, but I'd love to start with you, Shelley, for this question. What does food equity mean to you and to your work?
Thanks, Jason. Yeah, so for many in the food security field, we focus on access to healthy and nutritious foods, making sure we're looking at maps and having geographic plot points of where people can access food pantries or grocery stores in their local community. You know, it goes to the old Kevin Costner field of dreams. If you build it, they will come. So we build this perfect food system where everyone has access within a certain number of miles to their healthy and nutritious food, and we hope that they come and pick up the food. But for me, I think here at San Diego Food Bank, we really look at equity a little bit differently, and we focus on the outcomes, right? True food equity is so much further than just the access to food, but is the outcomes of the individuals receiving food the same? So in our community, we're implementing a database called Oasis Insight, where we're collecting across all of our nonprofit partners demographic data, and then we regularly analyze that data, and we're looking at any pockets and gaps in services, overserved and underserved areas. And in a specific zip code area where we have 14 food pantries in the community, we saw some interesting data that the Somali population was only going to one of our food pantry partners. While we had 14 of them, there was 13 pantries they were not accessing. So to really dig into this equity issue, we had to see what was going right at that pantry and what could be fixed at some of the other pantries, because we saw a certain population that was not accessing the food at 13 different sites. We had those sites available, the access was there, but they just weren't going. What it turns out is many of the Somali population were of the Muslim religion, and it was about the way that this particular food pantry handled their pork. So the one that all of the Somali population was going to would receive their whole allocation of food from the food bank. They would take their pork and actually put it in a different room. And then as families would come through, they were given a voucher for the pork. And if the people in that family would eat the pork, they could go in that room and get the pork. While we had provided access all throughout this community, we weren't truly achieving food equity because the families were not able to really access the site in the way that the pork was being handled. So what we did as a solution is brought together the 13 pantries that were not seeing the Somali population in their pantries, brought together a few of the key leaders within the Somali population, and we did a little field trip to that one food pantry and showed what was going right there. Everyone changed their practices, and then the Somali population was able to access food closer to their house at the 14 pantries that we had set up as access points throughout the community. So this is just one example where we met the geographic need by having the access, but really digging in further to the outcomes of the families receiving the food, making sure that food equity was truly being met.
Yeah, that's really great. Thank you for that, Shelley. And I love that really detailed story about making sure that you're reaching specific populations that live within a community. Melanie, I'm going to ask you the same question. What does food equity mean to you?
Well, like Shelley, Jason, I'm also reaching out to a very specific population. And for our listeners today, I think they might be surprised trying new foods for a variety of reasons. One out of four, but up to 80% of children with special needs will have trouble eating as well. So, because that's the population that's near and dear to my heart and that I try to help, for me, food equity really means that for kids with special needs, including pediatric feeding disorders, it's not just that they need a variety of foods in order to get better, but they truly have the right to them. They have the right to access the foods that are going to help them learn to become adventurous eaters and not suffer the consequences of poor nutrition, especially when challenged with developmental delays. So, the number one thing that helps me help them is exposure and exposure to all types of foods. And as Nancy mentioned, especially fruits and vegetables. But if the food isn't there for them to experience, then it's really impossible for me to help them. So food equity for me is so near and dear to my heart because it means it's a way for me to help children across our country.
Yeah, that's fantastic, Melanie. And you're right, exposure, right, to new things. Exposure leads to acceptance, acceptance leads to a habit. And really what we're looking for is creating those lifelong habits of produce as early as possible in childhood. And then I would love to pass this same question. What does food equity mean to you, Tequila, to talk a little bit about the work in Indianapolis?
So for me, food equity means that regardless of race, regardless of economic status, regardless of access, regardless of your nationality, that you have a right to have high quality, affordable food that is culturally biased to who you, what you are. So the work that we are currently doing in the city is making sure that we are being intentional about getting food to our communities, to our neighbors, to our friends. We are one of the things that my job is to do is to go into neighborhoods. We've heard the statistics about transportation and low access, right? Low income. And so how do we address that? Well, for me, it is simply taking the food to the consumers, taking the food to the participants, taking the food to our neighbors, and letting them have an experience with these food items. In addition to taking this food to them, we want to make sure that we're educating them on what to do with a lot of these items that maybe they just haven't been introduced to. One of the things that I find is that a lot of people in our community, they don't eat healthy because they don't necessarily know what to do with a squash. They don't necessarily know what to do with a beet, right? And so we don't just want to give them the food, but we want them to have an experience. So we're bringing in our partners through the Marion County Health Department and some of our local BIPOC growers and some of our local chefs here in the city, and we're taking them to these pop-up pantries, as we're calling them, and we're saying, hey, here's these items, but let us show you how to cook them. Let us show you how to use these items as staples into your home. So we want to be holistic in our approach to giving them this experience. We are tasked with being heavily a city that has is predominantly a food desert, right? And so we know that in our communities, our friends, they have to travel 3 to 5 miles to get to a local grocery store. So a lot of them don't eat fresh fruit and vegetables because if I don't have transportation, how do I have to go to the store maybe monthly. And so the easiest way to have what I need for the month is to buy canned goods or to buy frozen products. So we are partnered with Lyft here in our city, where participants can get 8 rides for $1 to local grocery stores and farmer markets. In addition to, again, partner with our local pantries, whether it be Gleaners, food banks, whether it be Gleaners or Midwest, and we're bringing food into these various neighborhoods that we find that are in food swamps as well as food deserts.
Yeah, thank you for that, Tequila. And you're right, access, right? Access can also add and create exposure for families, and really, access is such a critically important thing in communities, and especially in communities that don't necessarily have a grocery store right next door that carries healthy fruits and vegetables that they can bring home. Before we move on to the next question, I'd love Nancy, if you have anything that you'd like to add, feel free to unmute yourself and add any thoughts that you might have on what food equity means to really to PHA, but in reference to some of what our speakers have already talked about.
Sure. Thanks, Jason. Well, it's hard to, I think our panelists have covered pretty well examples of food equity and what it means in their work. I guess just what I'd add is, I've been at this for a while, working from the United Nations on food equity, leading one of the country's largest food banks, and now with the great privilege of leading PHA. So I've seen it from different vantage points. What really has struck me in the last year or two is the extent to which really smart people in our own public don't understand the basics. There is not, I think people do understand that there are people who don't have access to the same amount of food they do at their Whole Foods next door. But what they really don't get is that this is the breeding ground for diabetes, for heart disease, for early death by COVID, for so many of the consequences that we're suffering across the country. I mean, as Cory Booker loves to point out, rates of diabetes have risen from 5% to 40%. 1 in 2 Americans is sick. And I usually don't like to rattle off those dire statistics because I think we in the food movement are obligated to help people see the possibility and hope, and there's plenty of it, thanks to people like you all. But I think one of the benefits of talking about food equity is just that Americans are people who like fairness. And I think framing the issue as an equity issue helps people better appreciate that there are entire communities that don't have the same access, as Shelley was saying, to healthy food. So I think it's really important for us to not get tired of our own message. I think for a few years, I was like skipping past the assumption that we all get that it's not equitable. And I think it's really important to start there.
Yeah, exactly. Thank you, Nancy. And really, that's one of the reasons we started there, was to get this base understanding and what food equity means to all of the panelists here, but to just get a better understanding of some specific stories. I'd love to kind of dig in on some more stories from each of the panelists. So let's chat about some of the ways that your community, however you define that community, is improving equitable access to food through your work. So Melanie, I'd love to start with you on this one.
Sure. Well, really, two different ways. The number one way is by sharing the good work that PHA does across the country so that more families and agencies can access those resources on your website, et cetera. But on a more personal level, for me, because I'm working with families one on one, taking the time to help families access their local resources through their church, their community centers, their food banks, etc., that's really essential for these kids because many of these children have difficulty finding safe foods in their community, whether it be unsafe because of food allergies, unsafe because they're not able to chew that yet, or foods that are are hard to bring home and keep practicing for a while for that consistency. So that's why so many of the kids and families that I work with reach for those more processed packaged foods because they hang out on the shelf for a very long time. And kids with pediatric feeding disorders like predictability, they like sameness. So, a cheese puff is a cheese puff is a cheese puff every single time you open the package. But learning to enjoy an orange versus a mandarin versus a grapefruit is a totally different experience. And I often need to reach out to individual agencies that can help me find those specific foods for those individual families to help them thrive and live healthy and be well.
Yeah, that's an excellent point. I mean, you think about how many times some children would need, and any child really needs to get exposed to something new, especially with vegetables, in order to build those taste buds and to build that desire for that food. The risk of that often is really high for families. So thank you for speaking to that. Tequila, I'd love to talk to you and switch to you also about how your community is improving equitable access to food through your work.
Yes. So what we are currently doing, again, we have made this platform. We call it the Coalition for Food Access. And so what we have is quarterly, we invite community members to chat with us to see what the need is. Because I think in agreement with what Nancy was saying, the people in these various positions don't understand the importance of immediate access, of the immediate need, and how the health disparities that they are facing because of the lack thereof, right? And so we at each neighborhood may be different. So we allow this space so that neighbors can come and talk about what is needed in their community, what they lack in their community, in their spaces, whether it be what they need in the food banks food pantries that are in their neighborhood, what's going on in the grocery stores in their neighborhood, in the small markets in their neighborhood, the farmers markets. So we really want to be intentional about creating these spaces so that we respect and hear the voices of particular of individuals in particular communities. And then once we have had the opportunity to hear their voices and to see how we as a division can be impactful with what their needs are, we provide opportunities. So whether it be a pop-up farmers market, or whether it be I do community neighborhood outreach at least twice a month. And so I float around to various neighborhoods, partnering with local agencies in that community, whether it be the trustee's office, a local church, and we create this space where we're bringing in fresh fruit and vegetables. We're bringing in high quality items that they might not be able to get to a grocery store and get. In addition to that, we have these partnerships like with PHA, right, where we're providing 1,000 families with this fresh fruit and veggie program through the Good Food for All program. And we just are making sure that we're creating these spaces and these experiences for our families. We are partnering with several of our food pantries within the city, and we provide them with additional resources so that they can purchase additional uh, low sodium items, fresher fruit and vegetables. Because again, it's about the quality of that. And we want to make sure that we're being equitable in the items that we're giving to our friends in our various communities. So we're just trying to make sure that we're being intentional about what they are saying the need is and addressing it one community at a time, and being for me, my role is to be in that community, to be engaged, to be listening, and then take that back and say, hey, this is what they said they're needing. How can we assist? But not only just hearing their voice, but making sure that we're doing a lot of the follow through.
Yeah, that's excellent to hear. And I love, I mean, whenever we speak with folks that are working in the community, the idea of like how many assets are already in those communities that are working to try and get more food and healthy food and affordable food to families in cities across the country. I think that's an awesome story for something like Giving Tuesday. I'd love to round out this conversation around community improving equitable access to food through your work. Shelley, I'd love for you to talk about how the food bank is helping to improve equitable access to food through the work you're doing.
Absolutely, Jason. So our community is really twofold. Here at the San Diego Food Bank, we have 500 nonprofit partners who are really part of the infrastructure of the food bank. We could not do this work without them. They are all of the sites across the community at churches and social service agencies and senior living centers and transitional living and daycares and after school programs and elementary schools and middle schools who are doing this work boots on the ground, and we are the support for them, the food source for them. And as an example of what we've done in the last 2.5 years, we've provided over $2 million of capacity funding direct to our partners. As our funding was up, we understood that our partners were really important to the infrastructure of our food security system in San Diego. So providing, at the beginning of the pandemic, PPE and tables and cones and safety vests as we were having everyone shift from a walk-in food pantry to a drive-through pantry, refrigeration units, and everything they really needed to booster up their services and meet the higher demand because of the pandemic. So helping our partners is helping our community and improving the equitable access. But then the other part of our community is those receiving the food, and we always have to pay close attention to them. Like Tequila said, not just giving them food, but having them have an experience with that food. So we really focus on the experience and the dignity people are receiving when they come into any food pantry partner across our network or any of our direct service sites. We are making sure we're overcoming those language and those cultural barriers. Every form that we have go out to the community is translated into English and Spanish. We have also a community-wide universal food bank ID card so that people can access food really easily. And that is translated into 15 threshold languages, so that when somebody needs to get food, they can have that experience in their language, whether the person running that pantry speaks that language or not. We've had a huge influx here in San Diego of Ukrainian refugees, and one of the Ukrainian refugees reached out after their experience at a food pantry. They went and they showed up at the pantry. We had translated that intake form into Ukrainian. He knew a little bit of English, but it was very hard for him to access food. But once he got that food bank ID card, and he was able to use that throughout the community at all of the different food pantries, it made his experience going into each pantry less stressful, less anxiety provoking. He knew he had that food bank ID card and could go into any pantry and access food and not have to share again his address and how many people in his household and his date of birth over and over again at each unique pantry. But that universal ID card that we use through Oasis Insight client database is used like a library card is used throughout the community, right? You can go into any library with your with your card, and you can go into any branch and check out a book. This is really like a point of membership, right? When somebody has that food bank ID card, they know they're going to be accepted into the food pantry with less barriers to accessing that food, less language barriers. We put up signage in all the different languages of the local population, and we're always keeping a pulse on the database and the data coming in about the languages being spoken in our community. So like when we did see that influx of Ukrainian refugees coming into San Diego area, we were able to quickly get that professionally translated materials out to all of our partners so that when they were serving the Ukrainian population, they were welcoming with open arms and in the language and the culture that was appropriate to the clients served. We also, beyond just the forms, we do really encourage our partners and help support them in recruiting volunteers from the population they're serving, because we do want there to be the ability to have that dialogue with clients about the food and what is culturally appropriate for the families and what foods they want to be seeing. So we do really encourage and help our partners recruit volunteers who speak the languages of the clients and reflect the cultures of the clients really being served. So really in San Diego, looking at our partners and the people being served to improve the equitable access.
Yeah, thank you, Shelley. And it's so important. I mean, you talked about the familiarity of foods, but also some of the innovative kind of work that you're doing with the ID card. That's really really interesting and helpful. I'm sure for families in the community to feel welcome and to feel like they can access food there in the community. I'd like to keep the conversation moving forward here. I'd like to discuss the food system a little bit more holistically here. And maybe something that our listeners may not be thinking about, or what should our listeners be thinking about in order to make progress towards food equity? Tequila, I'd like to start with you for this question and how what are some ways that we think we can make progress moving forward towards food equity?
Oh, absolutely. I think about this question often because I think that sometimes we feel like if we do something, we've done enough, and so it's ever changing. The need we see that even coming on the other side of COVID, right after 2.5 long years of strenuous thing, the need continues to grow, and so how do we continue to meet the need of the community? I contend that a lot of times it's not even just for those families. We see an uprising, not just families with low income, but families that just don't, between the bills and between the taking care of the regular family, there just is not enough money to be able to eat a healthy nutritional diet that will address the health disparities that they encounter. And so really making sure that we're being advocates for all participants. We try not to use the word for low income or for free. We talk about we want to make sure that we're creating habits for all communities, for all individuals, so that they can address other barriers that they see because of whatever the disparities may be, right? And so for us, we want to enhance the ability to relationships in these neighborhoods, even providing resources and smaller grants for our local grocers in these communities to provide items that they may need, because it's hard for them too to be able to bring in fresh fruit and vegetables into their community, because now here's something that's not shelf stable, and so do I have to waste it? And if I buy it, am I losing money? And so we're providing resources for them that are in these communities. We're being partners with them. We're working with partnerships like PHA and Instacart and Safeway, people that agencies that are in our communities, and we're saying, hey, here's what we see. Here's the need. How can we as a team work together to address these needs? It does no good even for stores and programs to be in these communities and people can't afford to participate. And so one of the things that I love about our division is we are not only putting on these programs, but we support others that are doing programming. We're able to give out funding. We're able to say, we see that the work that you're doing, let us come alongside you. Let us, we do volunteering at a lot of the programs. If you send us your information and say, hey, we can't put this on because we just don't have enough people. Okay, let's get it out here in the atmosphere. We know that people are looking for opportunities to work and to volunteer and be proactive in these various communities. So we're making ways for people to volunteer because sometimes people just don't know what other people are doing in and through their communities. In addition, we're creating spaces for people in the same communities. For us, we find that there are sometimes 7 different pantries within a 3-4 block radius, and so we try to partner them with each other and create spaces and opportunities for them to talk and say, hey, well, we do pantry on Mondays. This is what our focus is. We won't have it this Monday. Maybe we can come and volunteer. So we're creating those sustainable resources and sustainable relationships so that we can be impactful longer down the line.
Yeah, thank you for that. I mean, collaboration and partnership, obviously, we're big fans of that here at PHA. So thank you for speaking about that. Some of the resources in the community that maybe even other community-based organizations don't know that they exist. I'd love to ask the same question, Melanie, to you next, thinking about, what might be needed to make progress towards food equity.
I just love the fact that you use the word holistic, because when I'm working with a child, I'm not just working with the child, I'm working with the whole family. And if there's one area of collaboration that means the most to me, it's that one professional that helps all the children and takes care of all the children in that family and supports those parents, the grandparents, the extended family, etc. That's their pediatrician. So for me, Jason, as a believer in early intervention for children with developmental challenges, feeding delays, etc., the earlier we reach out to families and their pediatricians, the better. Helping pediatricians identify kids with feeding challenges is one reason why I partnered with PHA and the Dr. Yum Project to create free handouts in both English and Spanish that will guide families and pediatricians on those early food exposures that you and I talked about earlier. When pediatricians provide these handouts to families, what it does is it opens up the conversation on food equity as well. And that's where I'd like to see more education on the topic across the system, is in the hands of pediatricians.
Yeah, thank you for that, Melanie. I like that, really the whole concept of as early as we can with children, and expose them to these healthy foods, the better off that they're going to be in the long term. So, and in terms of now, I'd love to turn it to you, Shelley, on this same question about how you might think we need to make progress towards food equity. What are some things that our listeners should know about making progress?
So, Jason, one thing that not all food banks across the nation are focusing on is SNAP benefits. CalFresh here in California, because we have to rebrand everything different than the rest of the nation. So I may flip back and forth between SNAP and CalFresh. But we've really seen huge progress during the pandemic in the CalFresh federal benefit, as well as pandemic EBT. So, back in 2019, I went to the Closing the Hunger Gap conference in Raleigh, North Carolina. And one quote that really stood out to me is somebody was on stage and said, "We're never going to food pantry our way out of hunger." And that's so interesting to hear another food bank say that about our own work. But truly, food banks and food pantries are really meant to be that immediate source of food for a family who's struggling to make ends meet. But the real goal is to get people on the public benefits of, free and reduced price school meals, CalFresh or SNAP benefits. And then during the pandemic EBT came through as a shining example of what can really be done when we look at these federal programs, right? Pandemic EBT came in and provided money for food for kids who were no longer in school and out remote. Here in San Diego, we saw record numbers of participation in that over the summer of 2020 and 2021. We really, in our community, have low numbers of kids participating in the summer meals program, going out to those school sites and libraries and park situations to pick up the meals during the summer. But the pandemic EBT was really a solution for making sure kids had food when they were not physically attending school. So really capitalizing on that success. And then with the SNAP benefit in the state of California, we authorized that to be at the maximum monthly benefit for each household size, and that still continues today. It's kind of it's authorized month by month at this point, so we don't know how long it's going to last. But that is a huge driver that we've seen actually decrease some of the numbers of people coming to the food pantries and food banks. At the height of the pandemic, we were serving about 600,000 people a month. If you looked at our statistics right now, we're somewhere between 450 to 500,000 people per month. So we've actually seen a dip since the beginning of the pandemic. And a huge thing we attribute this to is that people across our community have started to access the CalFresh benefit or the SNAP benefit that they are eligible for federally, and then that benefit amount is actually enough to feed the family. So here in California, the benefit amount can be anywhere from $16 to $240 for a household of one. Pre-pandemic, we saw lots of families getting just that $16 benefit, but when you look at their budget, they really didn't have enough money for food, and $16 was not enough. Often not enough to really drive people to go through the arduous process of applying for the benefit. So now during the pandemic that we've seen this benefit go to the maximum allowable amount and stay there, families are actually applying for this benefit. They're able to access foods in the grocery store, or like Nancy mentioned, the new home delivery things popping up through Instacart and Walmart and Amazon deliveries that you can actually use your EBT benefits for to purchase that food and have it delivered safely to your home if you're homebound or can't get out. And so that's been two huge successes, the SNAP benefit and the pandemic EBT, that have happened during the last 2 years. And we really need to take hold of those successes and make sure that they continue into the future to help families meet their food security needs.
Yeah, absolutely, Shelley. I mean, I think, the learnings that we were able to take from the last 2 years and really applying those moving forward is so critical, and really glad to see that some of that is happening and that you're raising that up. Nancy, I wanted to make sure you had a chance. I know you think about food equity every day and have been thinking about it for really a big chunk of your career. I'd love if there's any additional thoughts or comments you had on this area about how we can make progress towards food equity.
Sure. Well, I'm just so impressed with the panelists. Like, I'm grateful for our partnerships because I agree with every word that's been spoken, and
I think we might have lost Nancy for a second. We'll give her one more second here, and then we might jump to our last question and give Nancy time
private sector.
to speak up. There we go.
Yeah, it also needs to be the private sector that is stepping in and, helping to solve the problem. I mean, one of the things I'm continually struck by is that we have tens of millions of people in this country without access to good food, and we're tolerating that when we know it's the building block of good health. So I think really it's, as I was saying at the beginning, we need government to do its part. As Shelley's saying, food banks obviously are doing and must continue to do their part. I think we really do need to challenge the private sector to be bolder and to meet the government and to meet the charitable system. Because I agree with what Tequila was saying too about we don't like to talk about low income or certain communities. It's like we want all people to have access, all people everywhere. And the first step is really acknowledging that all people do not currently have access. And, I often say, there really are no people who support hunger. No Republican, no Democrat, no man, no woman, no tall, no short. if you ask them, do you think people should be hungry, would say yes. Or do you think people should, not have access to good food? No one would say yes. But it's an issue of political will. How much time do you spend on it? How much energy do you spend on it? Are we willing to make this a national priority for all sectors? Government, the charitable sector, the private sector, and individuals. And I think the time is now that we do that and do it in partnership and holistically, as others were saying.
Yes, absolutely. Thank you for that, Nancy. That's a really good segue, actually, to our last question. We've got a little less than 10 minutes here, but I'd love to hear from all the panelists about what you're excited about in 2023. And Shelley, I'd like to hear from you first on what you're excited about in the coming year.
Thanks, Jason. A couple of great things going on here in San Diego in the new year. Our Oasis Insight client database, we're continuing to spread throughout our partners. We're at more than 60% of our partners right now, and we hope to achieve 90% of our partners using that to really improve access to food throughout the community. We hope to achieve that 90% in the next 2 years. And we are also focused on home delivery to seniors. We had done some home delivery early in the pandemic in 2020. We recently partnered with DoorDash and are doing home delivery specific to seniors through that program. But we're looking at new models and how we really want to move forward with really expanding that home delivery beyond the senior population in 2023. And one of the things that I'm personally most excited about is through our partnership with Partnership for Healthy America, our Healthy Hunger Relief Index. It's our second year participating in this assessment across our staff. Last year we had 6 staff, which represented a wide variety of our departments, as well as levels within the organization participate in this. I just checked in with Carmen at PHA yesterday, and more than 50% of our staff, so more than 40 staff members, have completed the Healthy Hunger Relief Index. And this is a great tool for food banks to be really looking at 5 different assets throughout your food bank. How much do your staff know? How much is that information lifted up? The 5 areas are staff and board leadership, healthy sourcing, organizational culture, agency support, and collaborative partnerships. Because this is our second year participating, we do have some baseline data from last year, and I was really surprised to see how much great work we're doing at the food bank that I know about because I'm the programs director, but that maybe our operations team doesn't know about. Or maybe our accounting team doesn't know that we're nutrition ranking all of our food because we don't talk to our accounting department about that, and there's no bills behind it, so it doesn't really hit their desk. So we've got a real map to build our information within the food bank and really make every single food bank staff member and even our volunteer pool educated about the programs and the great work we're doing, because they're really our spokespersons in the community who are talking to clients, who are talking to agency partners, who are talking to donors. And they really need to know the great work that's going on in the food bank. And sometimes even internally, we work in silos. And I really see this Healthy Hunger Relief Index as a tool to measure annually our education of our staff within the food bank and our reach out to the public with that information of the great work we're doing in sourcing healthy food, ranking it by nutrition, supporting our agencies, and building those collaborative relationships throughout the community. So I'm personally charged up and excited about PHA's second year of Healthy Hunger Relief Index.
Thank you for that, Shelley. Yeah, and it's so great to hear about the uptake of that amongst the team and the growth for that index internally. So thank you for sharing that. It's really great note there. Melanie, I'd love to hear from you now about what you're excited about in 2023.
Well, I had so many things to say, but I know we only have a few more minutes, so I'm going to narrow it down to just one because I would say it's what I'm most excited about. As I mentioned earlier, I had the good fortune of partnering with PHA and the Dr. Young Project to develop handouts for not only pediatricians, but any health professional that is striving to help children find the joy in food from an early age. And that includes the aspects of food equity. So Jason, I haven't had a chance to tell you this before, but Just over the Thanksgiving weekend, I had over 100 direct messages asking me where to find these handouts on the PHA website and the Dr. Yum Project website. So what I'm most excited about is seeing the fruits of my labor of putting those handouts together, to see parents have easy to follow handouts that will prompt really important discussions with their pediatrician about that frequent exposure, especially to vegetables at a very young age, and how we can continue to partner with all of the wonderful speakers here today to make sure that people have that easy access to those important foods. And we're going to see kids getting good, sound nutrition for both body and brain growth. So that's what I'm very excited about for next year.
Oh, thank you, Melanie. That's great to hear. Again, that's amazing to hear about that work and the interest in that. And for anybody listening, at healthieramerica.org/firstfoods, you can download those Raising Adventurous Eaters with First Foods handouts that Melanie worked so hard on. So thank you for that. Tequila, what are you excited about in 2023?
Well, for the sake of time, I'll say the one that I'm really most excited about is about through this partnership with PHA. We have 1,000 family members who will have buying power in order to choose fresh fruit and vegetables, whether via Instacart or via Preston Safeway, which is a local grocery here in our city. They will be able to go to the stores. We will still be able to have recipes at the locations for them to grab as they're shopping. And so I'm just super excited about that, to be able to add additional funds to their income from month to month for a 3-month period, for them to continue to formulate these habits that we're doing through this 10-week period is super exciting. The response that we have been receiving from some of our participants has been amazing, and just hearing their excitement in anticipation of being able to go and shop and learn more and to consume more fresh fruits and vegetables in lieu of they're not only just doing it for their households. Now they're sharing this information that they're learning, and they're talking to their neighbors, and they're talking to their friends. And so we're steady getting calls and questions about, is this program going to be happening next year? So we're just trying to look at other ways that we can continue in some form or fashion this whole phase 2 of the Partnership for Healthy, with Partnership for Healthy America, for the Good Food for All boxes, because it has been very life changing for those that have been able to participate over the last 2 years. So I'm super excited about that.
Yeah, that's great. I mean, starting the new year with more access, greater access, more buying power, like you said, to fresh produce is really an excellent way to start the new year. Nancy, I wanted to give you a moment to just close us out here and talk about what you're excited about in 2023. But before I hand it over to you to kind of key in on that, and also to give us some closing remarks here, I just wanted to make sure that I took a moment to thank all of our panelists today. So Tequila, Melanie, Shelley, and Nancy, I mean, thank you so much for the engaging, enlightening discussion. I loved hearing all the different perspectives today. But Nancy, I'm going to turn it over to you to start with what you're excited about in 2023, and then to give us just a couple of closing remarks as we wrap up here.
Well, thanks, Jason, and thanks to all the panelists. I echo the thanks and appreciation. And again, they've illustrated what I'm most excited about. It takes a lot of work and years to develop the Healthy Hunger Index that Shelley referenced, that she's leveraging, and that we can continue to leverage. And Melanie knows how much work and how many people poured themselves into developing guidance that would be appropriate for all mothers and that would make the job easier for pediatricians. And Tequila knows how much we pour into our city-based work. That's kind of how PHA works, and it really illustrates what I'm most excited about is not only continuing to build momentum with our partners, but identifying like-minded partners. I think a couple of the speakers referenced it, but it's really important to realize that when you're tackling a huge goal, like shifting the entire food system so that all people have access to food and so that all people have access to good health, so that we actually have food equity. It really does take many, many, many people and organizations. And I think that some organizations try to own the whole space. PHA isn't like that. We try to identify people who are doing great work, to give them tools to accelerate that good work, to then share the work with others and to build on it and connect the dots. And so every time I have a conversation with our partners, I'm excited about those partnerships and what we can do by leveraging those partnerships, and frankly, the new ones that we'll build in 2023. Last thing, oops, we're at time, but I can't not say that this is a moment where our time has come. Our issues are here. The White House is prioritizing them, the business community is prioritizing them. And I think we can do this. So thank you.
Yeah, thank you, Nancy. And as I mentioned right as we got started, today's Giving Tuesday. So for PHA, Instacart's matching all of our gifts to PHA up to $50,000. So you can make twice the impact for families across America. So I hope you'll join PHA as we partner to transform the food system at every level. And thanks again for being here and for the support of PHA. If you'd like to make a gift, you can go to healthyamerica.org. And one last big, huge thank you to our panelists for participating in this critically important conversation. And a big thank you to you all for being part of the food equity movement. So we know that only together can we help families in need build a healthier future through sustained access to good food. So everyone, have a great day, and thanks again.